enter the room.
Hello, I'm one of the doctors in pediatric department. Am I talking to Jenny Carl mother?
Yes, doctor. I am
All
Milani
right,
Carr.
all right, okay. Can you quickly confirm your child name and age for me, please?
Yeah, she is Jenny Carr and she is two
Mm-hmm.
years old.
All
Two
right,
years
okay.
old.
And all right, and what would you like me to call you?
You can call me Milani.
All right, well, Melanie, nice to meet you. So, Melanie, how can I help you today?
Doctor, I'm really worried. My daughter had a
Mm-hmm.
fit at home a couple of hours ago. I'm really worried
All
for
right.
her.
All right, okay. Well, Nalini, nothing to worry about. You are at the right place, and we have a discussion, and surely I'm going to help you with that. All right?
Okay.
Okay, so you mentioned to me that your child has had a fit, right?
Yes, doctor.
All right, and can you mention, exactly when?
Yeah, it happened 2 hours ago at home.
All, all right, okay. And what was she doing at that time?
Doctor, she was
Mm-hmm.
fine, but like we were just sitting, and then
All
she
right.
started having all of a sudden some jerky movements.
Uh-huh.
But
Mm-hmm.
doctor, I have been feeling that she's getting some fever nowadays, but I did not
All
check the
right.
temperature.
Yes, yes. Okay. And for how long the fit started?
Yeah, the fit lasted
Lasted
about
for,
30 seconds.
all right, okay. And you mentioned to me that she is having this fever these days, right?
Yes,
So
doctor,
for how
yeah.
long she's having this fever?
Yeah, doctor, since last 24 hours, I have been noticing
Mm-hmm.
she's running temperature, and
All
also
right,
sometimes she pulled her ears.
all right, okay. So any have you noticed any discharge from the ears or maybe from the nose?
Yeah, there's some discharge
Mm-hmm.
coming from the ear.
All right, any discharge from the mouth or maybe any drooling of saliva?
No, nothing like that.
All right. Apart from that, have you noticed any cough with it, any wheezing sound in the chest?
No, no, doctor, no.
All right. Have you noticed that, she is pulling her legs towards her tummy these days?
No, doctor.
All right. Any confusion which she's
Mm,
showing these days?
I'm not sure, doctor. But she
All
was
right.
fine,
Oh,
just little bit fever
mhm.
she was having.
All right. Okay. And is this the first time she's having this fit? Or,
Yeah,
have
first
this
time.
ever happened before? All right. This
No,
is the
no.
first time. Okay. So, how have you managed this thing?
I
What were your reaction? Because, you're a mother and, I can understand, watching your child going through all of these things can be, sometimes
hmm
distressing as well, right? So,
Yes, doctor.
how you have managed this thing?
Yeah, doctor, I got really worried. I just called
Mm-hmm.
ambulance and brought her here in the
All right.
emergency.
All right. That's a really good thing. Okay. Apart from that, apart from this fit and this fever, was she active and playful before that?
Yeah, she was.
Mm-hmm.
Yeah, but
All right.
after this fit, I felt that she got a little bit pale.
All right. Okay. All, and for how for how long have you been noticing this paleness in
Yeah,
his
soon
body,
after
in
the
her
fit.
body?
Yeah,
All
soon
right,
after the
okay.
fit. Yeah.
And or any bluish discoloration of the arms or maybe maybe legs?
No, doctor, no.
All right, any bluish of the mouth, maybe?
No.
All
No.
right, okay. All right. So, apart from that, how was the pregnancy for you?
Sorry, what?
How was the pregnancy for you?
Yeah, the pregnancy
How
was
did the
fine, doctor.
pregnancy
Yeah,
went? All right,
it
okay.
was
And any
a normal
complication?
pregnancy.
Mhm.
No.
All right.
hmm
All right. Any complication at the delivery?
No, doctor, nothing.
All right. Is she up to date with her jabs?
Yeah, doctor, she is.
Mm-hmm.
Yes, she is. Yeah.
All right. And apart from that, apart from this thing, are you happy with the way she is developing? With the weight she is gaining, with the height she is gaining?
Yeah, doctor.
Mm-hmm.
Yeah, it's
All
normal.
right. All right. Okay. And you mentioned to me that she is having this ear discharge as well, right? So for how long she's having this ear discharge?
Yeah, same like 24 hours for one day.
All right. And what's the color? What's the quantity of this discharge?
It's yellowish in color and it's
Mm-hmm.
a
And it's
small amount.
all right. And any blood with it?
No, no blood.
All right. And have you noticed it from both ears or from one ear?
It's for 1 year, mainly on the right side.
Okay. All right. So do you have any family history of, this fits in your family that's run in your family?
No, doctor, nothing.
All right. Is she feeding well these days?
Yeah, a little bit is feeding less,
Mm-hmm.
maybe because of fever.
All right. And apart from that, any decrease in the frequency of urination, or have you noticed that, she is wetting her nappies these days?
No, I think that is
All right.
fine.
Okay, all right. Okay, that's really reassuring for me. So, you mentioned to me that, you really got worried about the whole situation, right? So, are you stressful now or in regard to this?
Yeah, doctor. I'm really worried,
Oh,
doctor. Is she
all
having
right. Okay.
epilepsy?
All right. Okay. Well, is there any specific reason why are you saying that it's
2 minutes
epilepsy?
remaining.
Yeah, doctor. Actually, I heard that somebody has seizures,
Mm-hmm.
so this is
Mm-hmm.
maybe a sign of epilepsy. I'm really worried, doctor. Is she got
All right.
epilepsy?
All right, okay, I'm surely get into that. But first of all, let me reassure you that what's your child is having, that is very normal in the child who's having, fever. Actually, you mentioned to me that your child is having a fever, and you also mentioned to me that your child is having this discharge from the ear, right? So most
Mm.
likely, your child is having this ear infection. We can, term is otitis media. That is actually the infection of a middle ear, and that's why your child is having this fever. And whenever and we term this condition as febrile conversion. So whenever there is a high temperature of the body, the child can get fits. All right.
Yeah, and doctor,
And
I'm
regard.
also worried about one
Mhm.
more thing. Is she having
Yes.
meningitis? Because I searched on internet
Hmm.
and there's something
Hmm.
called meningitis that is really serious for the kid. Is it meningitis?
Well, my dear, it's a really difficult question to answer right now, but at the moment, from the symptoms she's having, and from the it's unlikely that she's having this meningitis.
Okay,
All right.
doctor. Mm-hmm.
And I would like to examine your child as well. So if um do further investigation for your child as well. All
Move on
right.
to the next station.
All right, doctor. Thank you very much. Good job. Good job. I know you never got
Thank
time
you.
to the
Yes.
management. Good job. Yeah, there was a. I mean, yes, you took a lot of history, which was kind of, eating into your time. You
All
kept
right.
asking how stressed are you. I mean, you kept bringing that question in over and over again. But there was so much more to understand about this case that
Mm-hmm.
I would give less importance to that stress question towards the mother, right? So let me ask you one thing. So you said this was febrile seizure due to
Yes,
uh,
yes, I do.
what did you understand for the cause for this fever?
I feel like if she's having this ear infection, maybe.
Uh, yeah, so then she developed, fever, and so that
Yes,
was a reaction towards the high fever. That's how you
yes.
explained it. What would you give for management?
I haven't, I just asked her to bring her child because I want to, assess her further in terms of examination investigation.
That's okay. The child is on the other room, but you
All
just
right.
want to tell what would you want to treat?
Sorry?
What do you want to treat at this point as treatment?
Infection
Yeah,
because, we
actually,
have
this
to
is
lower down the
acute
fever.
otitis media, right? Acute otitis media of the child.
Just one second. I just want to ask something. So you said you wanted to treat the ear infection. With what would you usually treat the ear infection?
With antibiotics.
I mean, which antibiotic in particular?
Um, I'm not sure.
Probably you would give amoxicillin, right?
Yes, amoxicillin, yes.
Yeah, this child is allergic to amoxicillin. If you give her amoxicillin, it'll
Oh,
become a medical.
yes. Oh, yes. I haven't asked about the allergic question. I'm sorry.
It's
Yeah.
very important. As soon as you identify there is an infection, the next question you need to ask is, does she have any allergies?
All
Because
right.
times you're going to give penicillin, antibiotics. So you're going to start if there's a soft tissue or a ear infection, or you're going to start with penicillin. So that's
All
one
right.
thing you need to remember. Because in this case, other than lowering the fever, you need to treat the cause, and the treatment of the cause is your management. And if you haven't found that fact
Yes.
that patient is allergic to
Mhm.
penicillin, you lose this patient entirely. You haven't addressed the main issue. You understand?
Yes. Yes,
So
I understand.
that in the back of your mind, as soon as you understand infection, think about, can I give this person penicillin, anything penicillin? Is she allergic? So just have that
Okay.
in the back of your mind. But yes, I'm so sorry, Dr. Saman, you wanted to say something. Go ahead.
No. Just the same question I wanted to answer, that she need to treat acute otitis media, right? Because there's a cause of febrile convulsion.
Absolutely. Yes, absolutely. So basically, why does this actually happen? Like you mentioned that febrile convulsion is common, but let's hear it from the group. What do you guys think? Here, febrile convulsion is common. How would you tell this to the mother?
Well,
What are the
this happens to the to the children when they are having this high grade fever.
Yes, definitely. So usually what happens is the brain is it's developing. So they are not yet,
Mm-hmm.
as at this point at a high fever, the brain's response, overactive response. So usually this is very common amongst children of this age.
All
By
right.
the age 4, the frequency of this should most likely reduce. But it's
All
not
right.
that. Another thing is important, that febrile seizure, whenever you think about seizure, the first time you have seizure, they need to be seen by a specialist. They need to go to the first fit clinic, because the likelihood of developing epilepsy with the number of seizures that you have will increase. All right, so you have to treat this very carefully, these cases. Even though you're trying to tell them that febrile seizure is actually common, it's actually common,
Mm-hmm.
and it may lead to epilepsy if the frequency of it is increased. All right, so
All
you
right.
definitely want them to look out for this. So next time this happens, you want to give them cooling measures. You want to tell them to how to bring it down, because you're trying to
All
tell them
right.
at this point the child's brain is not that developed, right? So the response is a little overactive, right? So as soon as you feel that the child is developing fever, try different measures to bring it down, you know.
All right. All right.
So
And one more thing, I always have this confusion, whether the child is with the mother or not. How is, going to get this idea?
So most of the times it would be written in the stem itself, whether the child is with the mother or the child is with the nurse on the other side. But even the management plan, you will have to talk to the mother itself, right? I know
All
you
right.
want to examine the child. That's
Mm-hmm.
also a good thing. You can always, if you have a confusion, just say that I'd like to examine your child. If there are examination findings, they will give it to you. Because if you have a
All right.
confusion where the child is, go ahead and say, I want to examine the child. Because if that actually is a confusion in the station, either they will not respond to you if they don't have anything, or else the examiner also might say that assume, the child is not there, to
All
fill
right.
you in
Okay.
information. But
Mm-hmm.
always do everything in your power. So if you have that doubt, go ahead and say that I'd like to examine the child. If you can't see any information in the candidate sheet on where the child is. Yeah.
All right. Okay.
But beware of telephone conversations, all right? Don't just say that I like to examine the
Oh
child.
yes. Yeah. That I have added. Okay. Thank you. Thank you so much.
No problem. So, so if at all there is an ambiguity, use it to your advantage. Because if you don't know at this point where the child is, just say that I want to examine the child.
All right.
Either
Okay.
the simulator will not say anything, then you can just continue moving on talking about the management and explaining the condition, or else the examiner only might say that assume that the child is there. All right. Do you want to admit this child? All right. Yeah, we'll come to the management slowly, doctor. Let's just go from top to bottom. So, main thing about seizure, another important history that you need to take about seizure, especially a febrile seizure, is the before, during, after history, right?
Mhm. All right.
A condition called status epilepticus. Have you guys heard of that?
Yes.
Epilepticus. So
Yes.
status. So can anybody tell me what status epilepticus is?
Like
Any idea?
we have more than 2 seizures in 24 hours
It's actually without recovery. More than 2 seizures without recovery. It has a very
without
short,
recovery.
and
Hmm.
then they continue having. The other criteria is more than 5 minutes. So that's why duration is very important. You need to understand the duration. So you need to understand the before, during, and after history. So that's also a good one to actually differentiate more than 5 minute seizures. Yes, exactly, doctor. To understand what the surrounding was, like what was she doing before she had a fit? Like what is the thing that caused her to having a fit? Have you guys heard of this thing called anoxic, apnea? Is that something anybody has heard of? So basically what happens is when a child gets startled or something, they just have like, overreaction, and they kind of, thank you, doctor, they kind of collapse. They have an apneic episode, but that's a very common, I mean, that's actually a normal situation. It's like an overstimulation of the vagal nerve, and they recover from that. So that's a good way to understand, like, what was happening before, this seizure came on, and also to find out whether she was having fever, or was there any cause that could have caused her to have the seizure, is it febrile or not, right? Duration, during, exactly what you need to ask is, that is the most important question you need to ask, whether or not, if it is a status epilepticus or not. How long did it last? How frequent was it? How long was it? Right? Please describe what happened. Was there any incontinence, tongue biting, uprolling? Right? You need to understand that's one of the important things to understand. Whether to differentiate between a true seizure and a pseudo seizure, and what happened after. So you are looking for any post-ictal changes, like did it affect her brain? Did she have any neurological deficit after she had the seizure? You just want to understand, what did she have any loss of anything after the seizure, right? So that's kind of important to ask to understand the intensity of the seizure. So whenever a seizure case comes, just keep that in mind to ask before, during, after history, all right? And then start investigating the cause. So meningitis, one of the concerns was, is this meningitis? How to rule out meningitis? You basically ask, does she cry when you move her neck? Does she have some shyness to light? Those are good questions to ask to rule out meningitis.
So, doctor, and skin rash.
Skin rash, there you go. Good job. That's also another one, definitely. So, but then there was an infection source. You understood that there was an infection source with the ear. So that's how you bring it into management. So from what you have told me, I can understand that this, your child was suffering from a seizure episode, and this most likely is linked to a high temperature, which I'm suspecting is due to the ear infection that she might be having. So you can talk about the management that way. First of all, I'd like to tell you on different ways to bring down the temperature, because at this very young age, children are very susceptible to getting these kinds of seizure when the temperature goes up, becomes high. So we are going to tell you measures in bringing it down, giving paracetamol, tepid sponging, right? Make sure, try different cooling measures to bring down the temperature, so that this episode does not happen again. And then we need to treat the cause for which this fever is occurring, which is the ear infection. So mention that you want to treat the ear infection. And since you mentioned that she is allergic to penicillin, I would like to give you an alternate treatment. The treatment usually is, a penicillin-based antibiotic, but I'd like to give you another one since she's allergic to penicillin. That's the issue you needed to find out here, right? So you can mention that. I can look into my BNF and I can give it to you if you don't know the dose, and if you don't know that it's erythromycin. That's why specifically, I mentioned this part in the special notes. So there is a BNF, by the way, just in case. You know, your eyes don't go there. Anyway, so apart from that, social history, who takes care of the child, you ruled out red flags, that was good. And one important thing is to take the child to the first fit clinic every time any fit. Definitely take them to the first fit clinic, right?
Excuse me, please.
Hi,
Uh,
Dr. Abraham, go ahead.
Yes, it is not epilepsy, it is febrile convulsion. Why to take to the first fit clinic?
All right, yes, thank you for that question. So, any convulsion. So, what is epilepsy? Epilepsy is also a seizure disorder, right?
Yes,
It's
but first fit clinic for epilepsy, not febrile convulsions.
so first fit clinic is how the name is. It's the first fit. At any age, the first fit that you have, you go to that clinic because they need to assess you a little further. They will assess you and give you, you know, a better management plan so that it does not lead to epilepsy. So
Really?
febrile seizure, if it happens a little often, if febrile seizure happens like 2 times, 3 times in, a duration less than 5, even if it's less than 5 minutes, doctor, it's the first fit, right? So I'll post some links on the group on what the first fit clinic is and the fact that everybody has to go there in there if you experience first fit. So other thing is, oh yeah, what was I saying? Yeah. So the more the frequency of febrile seizure, the more the likelihood of actually developing epilepsy over time, by the way. So you are, trying to control that. You're trying to control the number of seizures this child has. So that's why you're trying to tell them that as soon as you feel that the child is having fever, try to use different methods in cooling her, be it paracetamol, be it other external sources in doing so. So definitely you want to get them reviewed by the first fit clinic. Even in this case, I will link some reading material for you guys on the group so that you can also this fact. Yes, go ahead, Dr. Saman.
Doctor, and I have a question regarding that. This febrile conversion needs more reassurance. You know why? Because it's written in the notes that the child will eventually get out of this seizures, febrile seizures, once she is 6 years old. So they're more common between 1 to 6 years of age. So we
Yeah.
will not label it as epilepsy because this is not a true seizure. This is just because of high grade fever. So, but please double check for us, yeah, as you do. So please double check is it right or time saying is right or wrong.
So basically, that's what I said, right? Since the child's brain is not that developed, it's very likely to develop, happen between this age group. But what I'm trying to say, this is not epilepsy. This is still febrile seizure. I'm trying to say with the frequency, the more the frequency of febrile seizures, that you might have a more likelihood of developing epilepsy.
Yes, very right. And please, can you tell that how much chance is increased? There is a slight increase in chance of developing epilepsy, but I'm not sure how much.
Said
Less than 3%.
Sorry, how much? Sorry?
Less than 3%.
less than 3%. Definitely put some, do some research and put that out. So the more the seizures, the more the percent would increase. So what you're trying to do is you're trying to prevent that from happening. Less than 3%. Dr. Beauty is also mentioned. All right, sure. Thank you, doctor. So that's why you don't want it to happen more often. You are still trying to, reduce it. Dr. Beauty has mentioned 6 months to 6 years. All right, 6 months to 6 years is the time, according to NHS, that the duration of these seizures that is more, that is normalized, right? But still, even in that period of when they could be having febrile seizures, you're still trying to reduce the frequency. All right. So even though it is normal and it might not cause complications, the more frequent it happens, it might actually cause complications. So you can't completely normalize it, saying that it's completely. Normalize the fact that this happens, but also the fact that if it continues to happen, it may actually lead to a seizure disorder. So we need to make sure that whenever she has a temperature, we bring it down. All right, and we try different methods.
I Google it. He said yes, a ferret febrile seizure in a child should be assessed in clinical setting, ferret clinic. Yes.
First, I'm sorry, I didn't get that. The first split clinic you were mentioning, you were saying something.
You are right. You are right. He said any febrile convulsion, send it to ferret clinic.
Not just febrile convulsion, doctor. Any convulsion for the first time needs to be reviewed in the first fit clinic. So do make note of that, guys. Definitely. And yes, Dr. Beauty, you've put out a link. Yes, definitely. I will be using that link for checking it out. Also, so you are managing the current. So what I'm trying to bring out in this conversation is that you're trying to manage the current seizures. Also, you are trying to safety net for the fact that there might be further seizures in this time frame of 6 months to 6 years. But we are trying, or we should make an effort to reduce it. Right? So you should, make your management plan in lines with that. You should make your management plans in lines for ways to actually reduce any further episodes. Number one. Number two, the other thing that you're trying to reduce it, if she does have any further episodes, what should you actually be doing? Don't be like actively going and trying to wake up the child. Just let the child be, make sure there are no sharp objects around, put her in recovery position, right? Those are important things you need to tell, because you're already telling them that this is a reaction of the body to a high temperature. And this might actually happen if she has another episode of a high temperature. And if that does happen, what do you need to do, right? But in the future, we will try that her temperature doesn't go up. So we will try different measures. And if you see that the temperature is going up, try to bring the temperature down from your side, from your end. Is that clear, guys? Anybody has any doubt, any questions? I will be putting down.
Thank you.
Yes, I will be making a blog on febrile seizure and the first fit clinic, and the risk of developing epilepsy, especially with frequent febrile seizures. So yeah. All right. Yes, let's look at the performance quickly. So incident history, this was missed. I think you asked duration, but you didn't ask the others. History of febrile seizure and epilepsy. Actually, this was actually asked. I'm so sorry. This was actually asked in the questioning. History of fever, asked about duration, any use of antipyretics. She did mention that she was running a fever, right? So since she was running a fever, you could have asked, like, did you do anything to bring it down? You didn't measure, I get it, but did you give her any medication? Did you do anything to bring her down? Because you need to understand from which point should you actually start treating them. Does she already have had paracetamol? If she's had paracetamol, how often did she have paracetamol? Now, your management would be tailored to whatever she has done so far, right? If she's given her one paracetamol, like 2 ml of paracetamol, then you should say that increase the frequency, right? Paracetamol can go up to like 4 hours daily as well. So you need to understand how much of management has actually given, so that I can tell you to increase it or introduce new drugs according to what you have done, right? So that was one important thing that you could have gotten. Any vaccination, so you need to understand what all the development of this child, see any abnormal birth, delivery, any instrumentation, that's all things that you're looking out for, especially in this kind of a case, right? So good questioning, but I would still give you. I would still only give you 2 marks, and good job in
allergy.
Because of allergy was the biggest thing, and also the incident history is also very important. All right, on what happened, you need to understand what was she given so far, because these are the things you need for management. You understand?
All right. Okay. All right.
That you're asking, try to ask yourself, how is this helping me in giving a management to a child? What am I understanding more about this condition? All right. Yes. Okay. So this is also positive. So I would have given you, but I would still give you 2 marks because that was the main thing to ask. That was the main issue to understand. Is she allergic to the medication I'm going to be giving her for the ear infection? Yeah. But as rule of thumb, try to, take in, understand the allergy history for any case, just as rule of thumb, just in case. And management, this is where you actually lost because there is so much to talk about management. So explain what febrile seizure is, why it happens in this age group, right? Prescribing the medication, why? Because of the allergy, because you want to treat the infection that is causing the fever, right? The different ways to bring down the temperature, advice on giving medical management, explaining the benign nature and the management, benign nature and management during a fit, right? That's also important, like what to do when it happens again, right? Because in this case, it may happen again. Since it's happened once, so we know that this child has a likelihood of developing a febrile seizure. So what should you do as soon as you see fever, right? Referring to the first clinic, safety netting, advice, return if rash, persistent crying, or increased concern. So any of the red flags that you asked, you can actually give it for safety netting, saying that if you see any of these things, please do come back to the hospital immediately, right? Follow up after you give the medication, you've given antibiotics, you've given cooling measures. After that, you want to see how the patient is doing, right? Especially for a child, set up a follow up to see how they're doing, and if the issue has been resolved. If not resolved, you have to do something more, right? You can only do that if you actually see the patient again. So definitely set up a follow up, leaflets and pamphlets on febrile seizures, right? Otherwise, interpersonal skills are pretty good. Interpersonal skills are pretty on point. Yeah. So good job, doctor. This case has been coming a lot. I know there's a lot of controversy around this. This is not an epilepsy. This is a febrile seizure. We are trying to reduce the frequency of seizures. We're trying to reduce, the temperature and treat the underlying cause. So keep that in mind. And also, we need to know what to do when a seizure does happen. These are things that you need to tell a new mother, what to do when the seizure does happen.
All right. Thank you so much.
No problem, doctor. Good job. Good job.